Welcome. I'm Lynn Davis, the Executive Director of Carroll County Youth Service Bureau. Our agency provides mental health and substance use counseling to children, adolescents, adults, and families living in Carroll County. And we have done so for over 45 years. In this video, you will hear about our outpatient counseling services, individual, family, and group therapy, psychiatric treatment, and also a little bit about our grant-funded and our evidence-based treatments. Thank you for giving us a bit of your time.
Walking into the building means that you've taken a big step and that you've asked for help, and that can be really scary. If you're not familiar with the Youth Service Bureau as an entity, you might think of us as just serving children. Although we do serve many children, we serve individuals across the lifespan. And what we focus on oftentimes is the family. So we're looking at co-occurring disorders. We're looking at developmental disorders that are affecting that. Are there traumatic brain injuries? How do we reach out to our LGBTQ plus community? How do we reach out to children who may be struggling with, suicide or self-injurious behaviors? How do we reach out into the school system to provide, parenting education or workshops? What are we missing, and how can we best serve a family? And how can we look at that individual not as just one piece, but as a whole system, so that people get the best care that they possibly can within our county?
We have these defiant kids coming in, so kids that don't listen, who don't like the word no, and who often become physically aggressive as well. So parents come in saying, I love them, but I don't like them. PCIT involves live coaching, a very highly specialized treatment room. We need top-notch technology, very engaging therapeutic toys, and we also have to make sure that the therapists remain faithful to the model that was created, learn about new and innovative research within the field, and then also network with other PCIT therapists. So the end result of PCIT is to have a child that feels very loved, a parent that feels like they enjoy being around their child again, and then a parent that feels more in control of their child's behaviors and less overwhelmed.
The BSFT program is an evidence-based program that aims to reduce the symptom that a child is presenting by targeting specific family interactive patterns that are linked to that system. How does the family talk to one another? How does the family resolve conflict? How does the family maintain order? How does the family show love and care for one another? Because it deals with those how kinds of questions, it allows us to really focus on promoting a sense of confidence and mastery within the family to solve their own problems, rather than promoting a sense of dependence on the therapist. So that's one of our goals, is that at the end of BSFT, the family really feels like they can go do what they need to do.
I think the community has had a positive reaction to the family engagement program. The community as a whole is becoming more informed about mental health concerns and how they can be related to juvenile delinquency. So when we look at folks that are coming through Department of Juvenile Services, and we're looking at them through a more clinical lens and trying to identify the individuals that need mental health treatment, we're able to provide that service that wasn't there before, and we're helping people understand that there are many different factors to juvenile delinquency where we can intervene.
A lot of families aren't able to make it to an outpatient clinic. In Carroll County, we are the only program that provides in-home family therapy in combination with case management. We're short-term, 14 weeks, and in those 14 weeks, we really try to support the family at the beginning of the 14 weeks. They're in crisis. So we'll go out to the home and stabilize initially, and then start to restructure those communication patterns between family members and build on those patterns, figure out what's going well, build on those strengths, and then link the family to ongoing services. We engage with local providers, Department of Social Services, Department of Juvenile Services. We can work closely with the clinicians here in the clinic and access their training. We can seek supervision from so many different people here at the agency and really figure out what we can do to really support these families in crisis. And hopefully, as the name suggests, preserve the family.
Because Connecting Youth has been able to forge partnerships and relationships with other agencies in the community, when someone comes through Connecting Youth, not only are they working with a handful of professionals here at the Youth Service Bureau, but they are really also accessing an entire network of services and agencies that the program has really worked hard to collaborate with. So I think that makes us very unique, and it gives us the ability to help clients in a way that maybe they weren't able to get help before.
Overarching goal of DBT is to provide clients with a life worth living. DBT originated working with clients who presented with borderline personality disorder. DBT has since expanded to work with clients that present with high risk and severe behaviors: post-traumatic stress disorder, depression, anxiety, eating disorders, and substance use disorders. Since the program started here, we have seen a decrease in overall inpatient stays with our clients, freeing the emergency room and the hospital, and it certainly maintains people in the community who can be productive and who can kind of stay consistent with their outpatient providers.
The reality is we have always had clients here who had substance use disorder issues. People are affected by mental health and by substance use oftentimes simultaneously, oftentimes with mental health as the underlying factor there. So we've developed a really great co-occurring approach to be able to address people's needs. We're always talking about mental health factors, we're always talking about recovery plans and relapse prevention, and we're always talking also about how to find outside supports and connecting them with the recovery community as well, because that's so valuable.
The goal of the ACT program is to reduce those ER visits and especially those inpatient admissions, and essentially to reduce costs that could be avoided by someone receiving regular, consistent mental health care. So when a person comes to the ACT team, we're almost sort of like the last resort, the last stop on the road. And I kind of like to think of us as kind of like a one-stop shop. If you need it, we have it. And if we don't have it, we're going to figure out how to get it. The team consists of nursing staff, housing specialists, employment specialists, substance abuse specialists, individual therapists, group therapists, psychiatrists, and a peer. So there's many different services that can be offered to a client. A lot of our folks can't organize the help. It's not that they don't want to do all those things. The nature of their illness makes it very difficult for them to put that all together.
I remember in previous years we treated substance use separately, and we were only beginning to think about this possibility that patients could have both a substance use disorder and a coexisting psychiatric condition. The treatment approach at this point is looking for that coexisting factors of substance use with any psychiatric condition, meaning as part of our diagnostic evaluation, we look for it, we ask the questions, and make the appropriate diagnosis and the treatment referrals for both conditions. We have 2 nurse practitioners in the clinic who provide the psychiatric assessment and medication treatment for patients. Between the 3 of us, we are able to provide the necessary services at this clinic.
The interns who arrive at the Youth Service Bureau are met with fully integrated training. So they don't just hit the ground running, but they come in and it's really a class format. So they come in and they're able to learn everything, not only about how we operate, but really preparing them for moving forward with their full year internship. They really work as a cohort. So they're working together to have this experience as they go through their time while they're here. And so that benefits them because they're learning from one another. They're not all coming from the same school. They're not even all coming from the same background. Not only do we have social workers, we also have counselors, psychology interns, and psychiatry interns. So they are getting a very full experience that other people would not get from an experience where they're going and they're working as one intern at an agency. And having interns also really allows us to serve more of a population here at the Youth Service Bureau than we would be able to without them. So as we bring the interns in, we're able to open up services to more individuals who have medical assistance, youth, adolescents, and adults. So it really benefits both directions.
From 1972 to today, many things have changed and evolved in the field of therapy. New methods, new theories, and hopefully less stigma. One influence that has not changed is our mission. We continually strive to learn, to research, to practice in order to give our clients the absolute best service that we can provide. Passion for helping others is our motivation. Now, as in our small beginnings, we continue to believe in the value of every person, the strength in people to do the hard work, and the hope that may be found in every person's life.